It's been a big 24 hours for Medicare, with the government announcing the single largest investment in the scheme since its creation, pledging $8.5 billion to extend bulk billing incentives and train more doctors and nurses in this country. The aim is to make 9 out of 10 GP visits bulk billed by 2030, and it only took a few minutes for the coalition to match that promise, adding on an extra $500 million. For their take, let's bring in Environment Minister Tanya Plibersek and Nationals MP Barnaby Joyce. Good morning to you. Tanya, this sounds brilliant for a lot of people. Free doctors' visits for all. But when will I be able to search for a local doctor and see 10 or 20 options who all bulk bill? Because right now, it's like finding a needle in a haystack.
Well, the first thing you should do, Nat, is check whether there's a Medicare urgent care clinic near you. We promised 50, we've delivered 87 of them around the country, and every single visit there is already bulk billed. As for your local doctor, we've tripled the bulk billing incentive already. This further expansion of incentives to bulk bill means that 9 out of 10 visits to the doctor will be bulk billed. And as you said, we're training the staff, the doctors and nurses, to make sure that they're there to provide those services. And, you mentioned that Peter Dutton came out and matched this immediately. What you've got to do is not look at what they say 5 minutes before an election. Look at what Peter Dutton did when he was the health minister in a previous government. He tried to introduce a $7 GP co-payment. He said that too many visits to the doctor were bulk billed. He tried to put up the cost of medicines, and he cut $50 billion from hospital funding. And that's why doctors at the time voted him the worst health minister in Australian history, because he wanted to cut Medicare. He said too many visits were bulk billed. Now, 5 minutes before an election, he says something else. Well, I remember when Tony Abbott promised no cuts to healthcare, and then he came in and he slashed and he burnt and he tried to burn down Medicare.
So a politician changing their minds. Right, I see what you're saying there. Barnaby, now you guys have said, I want what you're having, and the papers are screaming this: whacking an election on the nation's credit card. So can we actually afford this? A lot of people say, yeah, I want a free doctor. Who doesn't want a free doctor? But can the nation afford $8-9 billion of this?
Well, the first thing I'd say is, Tanya just said you've got to judge a government by what they do. Well, to this point, they've done nothing. So on this issue, it's late to the party. The next thing I'll say, we are framing up the Loch Ness Monster campaign here, isn't it? When they've run out of things to say, they come out and say, oh, there's a monster in the lake. It's, Medicare. They're going to sell Medicare. Who'd want to sell Medicare? First of all, it's a government service, and who'd want to buy it? We've got no intentions of doing that. Where does this rubbish come from?
Okay, let's talk about how we can afford it, Barnaby, because it's a lot of money, isn't it?
Okay, we must go back to Parliament. We must go back to Parliament, and there must be the discussion around a budget about exactly how this works. And in that process, you will definitely see Angus Taylor saying how he's going to pay for it, how we're going to pay for it, and we're going to see how the Labor Party's going to pay for it. So if you don't go back for a budget, you don't know how you're going to pay for it. There is my challenge.
Okay, Tanya, are you going to go back?
Well, hang on a minute. Just on that.
Yep. Okay.
Let's talk about that for a minute. Peter Dutton's promised $650 billion worth of nuclear reactors. He won't say how he'll pay for them. He's promised $10 billion worth of bosses' lunches. He won't say how he'll pay for them.
She's right, Barnaby. He hasn't said how he's going to pay for all the nukes.
What Peter Dutton said on TV is, we will cut. Yeah, he said we'll cut, but he won't tell you till after the election what he's going to cut. He said that on TV.
Barnaby,
we're going to make cuts. I'm not going to tell you till after the election.
Well, and let's go. The perfect venue for this is for the treasurers to duke it out during the budget. And so I absolutely see the earnestness of this. We'll see you in Canberra.
Okay,
we'll all go and have the discussion
Tanya,
about
on that question, are you going to go back and have a budget on March 25? Or was this the real election launch yesterday? Is the Prime Minister now going to call an election tomorrow?
Well, I don't know when the Prime Minister's going to call the election, but Peter Dutton could stand up today and do a press conference and say how he's going to pay for his nuclear reactors and what he's going to cut after the election. Why wouldn't he do that?
Are you going to have a budget on March 25th? Why does he need to be in Canberra to say that?
It sounds like we're not going to have a budget.
I don't know. That's entirely up to the Prime Minister.
Right.
That's entirely up to the Prime Minister. But there's nothing stopping.
Let's talk about the polling out today. This is also leading all the press. New polling data puts the coalition in the box seat to claim victory in the next election, which we're not sure it's about to happen, but we're not sure of the date. Leading by 55% now over Labor in two-party terms. Tanya, the majority of voters also say even last week's interest rate cut won't affect their vote, 59%. How concerned are you about that?
Well, it's a very tight poll. We know that it's a challenge going into this election, and that's why we're so focused on reminding people of what the real choice is here. It's a choice between a government that will invest in Medicare and a party, the Liberal Party, that has cut Medicare every opportunity
Well, it's
they've
not
had.
actually a choice,
And
because
we'll
you guys have got the same policy now. It's actually the same bulk billing policy by the look of it.
And that, yeah. Except don't look at what they say 2 minutes before an election. Look at what they've done when they've been in government. And when Peter Dutton himself was the health minister, when he was in charge, he said too many visits to the doctor were bulk billed, and he tried to introduce the $7 GP co-payment. We had to stop him. We had to vote against that in the Parliament. We know what he has done as health minister. You don't need an imagination. You don't need to think about the future. You just need to remember what he did when he had the chance.
To follow your logic.
Okay.
You need a big imagination.
You just need a bit of history. You just need to remember the history.
He's not going to bring in that policy.
The reason the polling is where it is because of cost of living. Your intermittent power plan was a disaster.
Okay.
And
People are
what's
hurting.
your plan for cost of living, Barnaby?
It hasn't been
What's
addressed.
your plan for cost of living?
Well, the first thing is to get rid of this crazy intermittent power plan.
What's your plan for cost of living?
At the core, I'm telling you, at the core of everything is the price of power.
And that's going to fix cost of living,
is it? And you're 82%
So in
renewables
2040,
by 2030
when you bring in
insanity.
nuclear,
and
that's going to fix cost of living.
You're still sticking to your intermittent power plan. You're still
when you bring
sticking
in
to your intermittent
nuclear,
power plan. It is crazy.
What's your plan for cost of living,
You're right,
Barnaby?
Tanya, we need to do a segment just on nuclear, because nuclear will take a while to get in and we don't know the price, but maybe it's a good idea. We need to do just a segment on that.
And Barnaby will never say what his plan is for cost of living.
They say they will before the election,
ask him what's his
should be
plan
called
for
soon.
cost of living.
Barnaby, before we go, I know you're concerned about a friend and former Nationals MP. I know he's had a few troubles in his personal life. What do you want to say about him?
Very serious. Michael, if you're out there, could you please contact Carla? Can you please contact the police? Can you please let people know you're okay? And if anybody has seen Michael or knows where Michael is, can you please contact Crime Stoppers? Michael, if you're there, mate, there are so many people who love you, and we're really scared, mate. We're really scared. Please stick your head up somewhere and say good day.
Okay, that's former Nationals MP Michael Johnson. Thank you both very much. We'll see you next week. Here's Chavo.